This is Aging Forward, a podcast from Mayo Clinic about the science behind healthy aging and longevity. Each episode, we explore new ways to take care of our long-term health, the health of our loved ones, and our community so we can all live longer and better. My name is Kristen Meinzer. I'm a writer and journalist, and I'll be filling in for Dr. Chen for the next several episodes. For this episode, we're talking about sleep. As you've gotten older, have you noticed that your sleep has changed? Maybe it's the amount of sleep, the quality of sleep, or even the ability to fall asleep. Our guest today tells us why some of that may be due to the aging process, and some of it might not be. Dr. Melissa Bogin is a geriatrician and internist at Mayo Clinic in Rochester, Minnesota. She's the assistant professor of medicine and senior associate consultant in the Mayo Clinic Department of Internal Medicine, Division of Community Internal Medicine, Geriatrics, and Palliative Care. She'll tell us why your sleep is getting worse and what you can do about it. Dr. Melissa Bogin, welcome to the show.
Thank you so much for having me. It's my pleasure.
We're so excited to have you here today to talk about one of our favorite topics around here, sleep.
Yes.
All right, to begin with, how does sleep naturally change as we age, particularly in our 60s and beyond?
You know, when I'm talking to my patients, they're like, something has changed with my sleep as I've gotten older. There's been a lot of research that's been done in probably the last 50 years about this topic. And we know a couple of things. We know that when you go to sleep, there's a specific type of way that our brain looks when we're asleep, when we're younger and when we're older. But what we see is that pattern really looks different. When you look at a younger person sleeping, they have this really lovely cyclical process during the night where the brain ends up going into deeper sleep, and then we end up going into lighter sleep, which is often what we think about with REM sleep. So that's where people are dreaming. If we look at an older person in contrast, what we'll see is that most of the time, older individuals are not going into as deep of sleep. It's not quite as deep as when they were younger. They also spend less time in that dream state, that REM sleep. And so that's also something that's different.
So older adults might have less deep sleep. What about the fact that when they are asleep, a lot of them have to get up many times during the night to go to the bathroom, for example? What about that kind of stop and start kind of sleep?
The fragmentation of the sleep. So this has been studied in large population studies. There's many more times that people are awake overnight compared to when they're younger. And so not only are we not going all the way into that deep restful sleep, but we're actually more disturbed. And so the greatest challenge, though, is that not every single person who gets older that has this sleep pattern has insomnia or reports that they have a problem sleeping. And so there has to be some other component to why individuals are not sleeping as well as they get older, because those brain changes are seen across the population.
So older adults, their sleep isn't as deep, it's more fragmented, but what about the quantity? Are they also getting less sleep? And how much do they even need?
This question, this age-old question about how many hours of sleep is the right number of sleep, continues to plague us as doctors and researchers. And so, unfortunately, I wish I had an answer to say, if you get this exact amount of sleep, your optimal health is going to happen. Unfortunately, we do not, as of yet, know that information. What we do know, however, is that in a large study in the 2010 range, they looked at large populations and they found in younger adults as well as older adults that a lot of people who kind of got between that 6.5 to 8 hours of sleep, they did fine. When we looked at people who got very, very little sleep, so like 3-4 hours of sleep, they didn't do as well over time with their health. And then when we looked at people who slept long time, like 10, 12 hours, those people also didn't do well. So what that really means is that there was a lot of the population, including older people, that got between 6 to 8 hours of sleep and actually did fine with their health. So what does that mean? It means that this quest for us to get 8 hours of sleep or more every single night is probably not feasible for most people. not even just as they get older. Okay. That's crazy, right? Because
It
that's so
is. We've heard
different
that
than,
8 hours our whole lives.
we all
Strive for the
hear
8 hours.
Yes,
Even more is
yes.
better.
That's exactly right. So I think the gut reaction to this is it really depends on how much sleep that person usually got before they got older. So I tell people, if you are one of those lucky few people that you really could get 5 hours of sleep and you could power through the rest of your day, that's probably unlikely that when you get older, you're going to suddenly start sleeping 8 hours a night. And so I think in generalities, probably older adults get a little bit less sleep, but I don't think that we can really say that it is a tremendous amount less.
What are your thoughts on napping?
People say napping is bad. No nap. That's not true. Napping is actually a totally normal thing as we get older. 30 minutes to 60 minutes can really make people feel better. And that also would count for your total amount of sleep in 24 hours. So if you think about maybe they went to sleep at 10 and they got awake at 4, which would be 6 hours of sleep. But if they got a half an hour nap or an hour nap during the day, there's your 8 hours.
Oh, that's great to know as somebody who just took a nap before today's taping.
Perfect. Love it.
So just a bit earlier, you mentioned brain changes in older adults. What actually are these brain changes that might be causing people to sleep less deeply or not have all the same sleep cycles as a younger person or to wake more easily?
So in terms of the brain produces a chemical called melatonin. I like to think about melatonin is the hormone that basically tells your body it's time to go to sleep. And as we age, we produce less melatonin. So we already know that that process of trying to go to sleep and then maintaining the sleep is impacted by less melatonin.
How do changes in circadian rhythm and melatonin production, how do those affect sleep timing and quality over time?
So we know that melatonin levels decline over time. And so when you have less of that, people may not feel that urge to go to sleep as much. On the flip side, however, what we do know is that many older individuals will find the desire to go to sleep earlier and therefore will wake up earlier. And so this is something that we call an advanced sleep phase. And all that means is that instead of going to sleep at midnight, you might want to go to sleep at 9. And that's not necessarily pathological. The biggest challenge with that, though, Kristen, is that then you have people who wake up early, right?
Yeah, some of the older adults I'm friends with, they're like, I keep waking up at 4:45 now.
Right. And so this can be a disease. There's some people, for example, who feel an irresistible urge to go to sleep at 6 p.m. and then they wake up at 2 a.m., right? And that's a really big problem. And so that's treated totally differently. But what we do see is that ability for people to stay up quite as late, that does seem to change over time.
Okay, that's good to know. So that can be perfectly normal. It's the extreme end of things where we should get concerned.
That's exactly right.
Let's visit that myth about poor sleep just being a normal part of aging. How much sleep decline truly is age-related versus caused by illness or medication or maybe a change in lifestyle habits?
So the short answer is no, that is not a normal part of aging. It is something that we often commonly see as part of the aging process, and it still doesn't mean that it's normal. So the first question is what part of aging is really driving this perceived bad quality of sleep? There are some changes, like I've said, to the sleep cycle that we know happens at a large population level. And so that fragmented sleep, there is a component of that is going to affect the perceived quality of your sleep. So if you're awake multiple times to urinate or you're just disturbed during the night, there is the likelihood that people will perceive that their sleep quality is not as good because it's different than it was before. So I think from that standpoint, there's definitely age-related changes that are from just the aging process itself. The biggest challenge about that, though, is that there are many individuals that I see in my practice. They may say, yeah, I sleep a little less, but they're not really bothered by it. And so we wouldn't actually label it as a problem.
So just because your sleep is impacted by age doesn't mean it's necessarily poor sleep.
Mm-hmm. So the question becomes, at what point do people as they get older, if they feel that their sleep quality is negatively impacted, who are those people? Because it's not everyone.
Mm.
One of the hardest parts about aging is that there are so many other things that are not just part of the aging process that cause us to have interruptions in our sleep. And so there are so many of these that we could talk about. Things like pain, people may have joint pain. A lot of medicines that people are on may actually impair their ability to sleep. The issues about frequent urination, where you're getting up multiple times. And then we also have a lot of people where they have a disruption in their normal schedule. So they may have been working for many years, and then as they get older, they retire, they may not have that strict schedule anymore. And so people may be going to sleep at different times, and then the body is not really primed to go to sleep at the same time like it was before. It's also important to remember that many people are dealing with a lot of life stressors and changes as they're getting older. And so a lot of the issues we have to think about as well are, how are people's mood? Are we dealing with a lot of anxiety where we're thinking about things overnight? Is it a depressive issue where they just wake up really early and they can't go back to sleep? And so there's all of these things that we can see as people age. It's just a question of who actually suffers from it and who is not bothered.
Mm. So, what are your patients' most common complaints about sleep?
There's two really common complaints that I get. So the first of them is that many people will say, Dr. Bogin, I can go to sleep, but I can't stay asleep. So they'll say, I go to sleep at 10, which is my normal time. Then I wake up at 1 or 2 o'clock, and then I'm awake for an hour and a half, and it drives me nuts. And then maybe I go to sleep for another hour, and then I wake back up. And so we call this sleep maintenance insomnia, which means we can go to sleep, but we can't stay asleep. The other thing is that a lot of people perceive that it's just different, that the experience of sleeping is different. And that may just be that my head used to hit the pillow and then I was out for 8 hours. And so a lot of it is an adjustment. You may take medicines that you have to get up overnight to take them. You may have to use the bathroom overnight, right? And so those things are really hard to get used to.
And what are some warning signs that someone may have an actual sleep disorder rather than just occasional poor sleep or some expected changes in sleep?
The things I tell people to look out for right away in terms of poor sleep quality, the number one is people that start snoring or people that stop breathing during sleep. So sometimes people will say, oh, my husband woke me up because I stopped breathing overnight. And that is a sign often of sleep apnea. So this is where you stop breathing during sleep and then people continue to wake up multiple times. That can affect the heart and the lungs and the brain over time. So it's very important that if you have those symptoms, you go to your primary care provider to do further assessment. The other thing that, while it's rarer, I think it's worth noting, there are some people that start to have behaviors when they're sleeping. So that may be things like you're sleeping in your bed with your husband or your wife and they start punching you or kicking you, or there's a lot of movement overnight, or they may act out dreams. These would be things that also could be indicative of an underlying brain problem and would warrant further medical attention. So I tell people, if you have any of those things, you definitely need to see your primary care doctor. And if you don't have any of those things, but you or your loved one starts to develop new problems with sleep, it's always a good idea to go to your primary care provider and talk to them about that.
So, how often is it that with older adults, the solution is as simple as just don't sleep in the same bed as your spouse?
That is a great question, Kristen, and I'm glad you're asking, because actually it's pretty frequent that we have people that will say whether their husband or wife or their spouse is moving around in bed, or perhaps they have to get up and take phone calls.
Maybe they're getting up to go to the bathroom.
And I tell people, honestly, that is completely seriously, that is on the docket, is sometimes trying to change that environment and be by yourself and see if that improves your sleep is a totally reasonable and low risk way for us to try it.
It may just be as simple as go sleep on the couch.
Or maybe you send them to sleep on the couch and not you.
Yes. You don't need a magic pill for that. Why is it that older adults seem to be more vulnerable to certain sleep disorders like insomnia, restless leg syndrome, sleep apnea, things we don't hear teenagers complaining about?
The hardest part about aging is that there are so many things that are just age-related, as in they are natural decline over time related to the aging process. The tissues just are not as good, perhaps, as they were when you were younger. And there's also a lot of disease states that develop as people get older, which may be partially due to the aging process and may still be due to other things like lifestyle is a big part of that, maybe genetics as well. And so the part of the issue is that there's all of those things coalescing that can really make it harder for people to get good sleep and seem to impact our older adults more frequently. Other factors, though, often have things to do with just the body components.
Oh, so like parts of the body can change the quality of our sleep too. What are some examples of this?
So that's things like people having sleep apnea. As they might gain weight and lose muscle as they age, many of the times people will have more laxity to their throat, for example, and they may develop sleep apnea where they stop breathing, and that's very disruptive. Other common things like issues with people having frequent urination overnight, whether that's a prostate issue, whether that's from medications. And medications are really a very common reason that older adults will have interrupted sleep. It may just be a side effect of other medications.
What about restless leg syndrome? What do we think is the cause of that?
When you think about things like restless leg syndrome, this is an age-related process, and it's not quite understood why some people get it. It may also be that we're seeing there's an association between iron deficiency and restless leg syndrome. So when we think about iron deficiency, that tends to be more common in younger women, but we can also see it in people who may be on a blood thinner as they get older, and they may be having slow bleeding somewhere. And so that can also cause people to have that restless leg syndrome as well.
Let's dive into the medical conditions that commonly interfere with sleep as we age. For example, arthritis, cardiovascular disease, menopause, dementia. Why are those linked to sleep challenges?
One of the biggest issues is that there are different types of insomnia that people can have. And when we say primary insomnia, we mean that there's nothing else causing it. You just don't sleep well and you can't go to sleep or you can't stay asleep. And then there's this situation which is called secondary insomnia, which is where the sleep issue that you're having is not really primarily driven by the sleep process itself, for example, but rather from these other conditions. So untreated pain is an extremely common issue that impacts sleep. This is things like arthritic pain, low back pain, knee pain, etc., any sort of pain that one could have, that can really negatively impact people's sleep. And so something like even taking an acetaminophen or doing stretching, applying lotion to the legs, for example, there's a variety of things that can be trialed to see if we can ward off some of the pain-related interruptions to sleep. A common one is asthma, right? They may not be aware of it, but actually they may be having trouble breathing or wheezing. Like I said, sleep apnea, those things can also interrupt the sleep quality. Other diseases like anxiety and depression, those also can really negatively impact the sleep itself.
Beyond medical issues, what environmental or societal factors can worsen sleep later in life?
There's a lot of other things that can really impact the sleep overall that older people tend to be more susceptible to. So common things like alcohol intake, which many people think about alcohol and say, well, I drink the alcohol and then I go to sleep. And while that's true, because alcohol is sedating, we do know that ability to go into that deep sleep is really negatively impacted by alcohol. So people that may be drinking more, they actually are more likely to have interrupted sleep. This is also true about caffeine. That really negatively impacts your ability to go to sleep. And so the American Academy of Sleep Medicine actually recommends 10 hours from the last cup of coffee, last caffeinated beverage to the time you go to sleep. So to put that in perspective, if you like to go to sleep at 10 p.m., your last cup of coffee should be no later than noon. So for people like myself that love the afternoon cup of coffee, that's something that often can happen as we have more of a free schedule. One of the other things that can commonly happen, that societal factor, is that when these life transitions happen, sometimes people get lonely. Sometimes people are not really as engaged with their communities. And then that's where we start to also worry about mood symptoms like anxiety and depression.
So let's talk about the consequences of poor sleep. What happens to the body and the brain when we consistently don't get enough quality sleep?
So The research that's been done at this point indicates that sleep is a really crucial restorative process. And that means not just for the brain and the cognitive health, but for the body overall. And so there's been so many different studies that have looked at the impact of chronic sleep deprivation, like over long periods of time where people get either inadequate sleep or poor quality sleep. And this has very wide-ranging effects. As I've mentioned, the risk for cognitive decline. Other things that we see are there does seem to be a risk of ischemic heart disease. It seems like the immune system even needs you to sleep well to be able to rejuvenate your immune system and fight infection. So the greatest challenge of all of these is that the exact mechanism of how the poor sleep does this to these other systems is still being actively studied at many institutions and by many people.
Now, when we don't have enough sleep, we're frequently not as coordinated as we would be otherwise. And older people are already at risk for trip and fall accidents. How does sleep deprivation affect that?
When people, and particularly older people, have trouble with sleeping, that really affects that cognitive centers of the brain as well. What we also see is that those sorts of things impact coordination. So your ability to react, your ability to be able to make sure that you're putting one foot in front of another. And sometimes it may just even be the awareness of what's happening to you as you're walking may be impaired. And so persistent, poor quality of sleep does put older people at risk of falls and other adverse events. And so it's really important we identify when people have that so that we can have a conversation about what can we do to try to fix it.
Speaking of which, for caregivers and family members, what warning signs suggest poor sleep might be becoming dangerous to someone's health or safety, that maybe it's time to take our older family member or friend to get some special medical attention?
It often depends on what the medical situation is to begin with. But I think things like if you have a person where they really cannot do the things that they normally do because they're falling asleep the whole day, or more concerning, if you have people that are falling asleep when they're doing tasks that are dangerous for them to fall asleep. So for example, if you have a person who falls asleep when they're driving, or you have a person that may be doing some sort of risky activity outside in their yard, for example, and they're falling asleep, all of those things are definitely something that needs to undergo medical evaluation. I think that things like people just feeling really fatigued. So if people say, oh, I just feel like I'm not getting sleep, I'm really not motivated, I'm not energized, any of those things that then impact their daily living, whether that's their job, their relationships, all of those things would warrant medical attention.
I'm curious about your thoughts on sleep medications.
The short answer is there are so many other amazing things that we can do to try to help our sleep that are not medications. So we've all had that terrible, terrible night of sleep that next night we're really scared that we're not going to sleep well and that we feel desperate that we need to have a good night of sleep. And so this is really where the idea of these over-the-counter sleep aids came from. The big thing is that a lot of the common sleep medicines that are available over the counter, so things like Benadryl, ZzzQuil, NyQuil. There's so many of them. The biggest issue with these is that while they do make you sedated, sleepy, they help you go to sleep, they also have so many other side effects that tend to particularly hit older individuals. And so these are things like constipation, dry mouth, dizziness, which is a really big one and very scary when it happens to people. It can also cause confusion in people. And then there's a whole host of other side effects. Some of them contain compounds that can raise your blood pressure, for example. And so this is why it's really important that people talk to their healthcare provider before they would even start something like that.
Some people, they're like, I've been taking a Benadryl every night for years. Is there a reason they should stop if they've already been doing it for a long time?
And this is really, really common. You have patients that sometimes have been doing this for 50 years. And what I tell people is that when you're younger, oftentimes you're not as impacted by these side effects. As you get older, though, that medicine over time and through the aging process is more likely to negatively impact you. And so I do tell my patients that are taking medicines like Benadryl, for example, chronically, that this is an opportunity for us to partner together and think about what other ways can we optimize your sleep. And is there an opportunity for us to stop this medicine before we start to have untoward side effects?
Let's talk about the prescription sleep medications now. What are your thoughts on those and what should folks out there be aware of?
Some of these sleep medicines came out in the 1930s, 1940s, and they do help sleep. I want to start by saying that, Kristen. People are like, well, they don't work. Well, that's not true. These medicines can help people sleep. The issue is while there has been advancements in the medications, the greatest challenge is that even in the best controlled studies that we have is a disproportionate risk of side effects in older people. One of the other challenges is that in some of the older studies, older people were actually not included in these studies. And so that is not really representative. So when we think about these medicines, we really are thinking about using them rarely or sparingly. And we also never start these medicines without realizing we need to very, very carefully monitor for side effects.
Like what?
Things like oversedation. So meaning it isn't that you just go to sleep, it's that it's hard to wake you up. Other things like dizziness, very common side effect of all of these medicines. So if you get out of bed overnight and you're dizzy, you're more likely to fall. There's also some risk with certain of these medicines to have some dream enactment behavior. So people acting out their dreams, sleepwalking, etc. And so this is all to say that it's not because these medicines are per se bad, it's that they are risky to older people. And so my goal in clinical practice is to try to avoid them unless we have absolutely exhausted everything else and we have a shared understanding of not only the potential benefit to you, the potential risk to you in the short term as well as in the long term.
That makes so much sense.
There is one thing, however, that is not medication that is absolutely critical that I talk to all of my patients about that have issues with insomnia and has been studied also in older adults and been found to be extremely effective. And this is cognitive behavioral therapy for insomnia, or what you might see online as CBT-I. And what this is an acknowledgement that when people have slept poorly for a long time, we often develop habits that try to help us sleep, but in the long term may actually not help us sleep or may actually impair our sleep. They may drink before they go to sleep to try to help them go to sleep. And so there's so many things that we might be able to break habits and instead develop better habits that will give us a longer duration of improvement in our sleep. Some of these studies have found that people can have benefit for years with these techniques. And this is something that not only can you enroll in, for example, with your healthcare provider, there's a lot of apps. So I always recommend that because that is the strongest evidence we have for how to improve people's sleep, including in older people.
Let's talk about some daily habits that can be effective that will hopefully curtail some of those sleep issues. So, what are some effective daily habits older adults can adopt to improve their sleep naturally?
There is so much data that there are so many things people can do to be able to improve their sleep without the use of medications. And so the first of those is I really strongly encourage older adults to exercise. We know that exercise in and of itself is great for the whole body in terms of your cardiovascular fitness as well as longevity. But what we also know is that when people do more physical activity, they sleep better. When you're really tired out after a long day of working, sometimes all you want to do is go to bed, right? And so I tell people, if you can really adhere to, for example, the American Cardiology College guidelines, getting 150 minutes of moderate intensity activity, that is also going to help their sleep. Other things are those habits that we've talked about. So trying to reestablish a routine, try to get a sense of what time are you going to go to sleep at night? What time are you going to wake up? It may just be a choice to say, I'm going to set an alarm, which means I have to go to sleep at a certain time. Giving yourself and your brain the ability to wait and anticipate that it's time to go to sleep can also get the brain into the state that sleep is more easy to come by.
Do you have any other tips?
Limiting your caffeine to 10 hours before you need to go to sleep, and then also avoiding alcohol intake right before bed. And so I tell people, like, we're not saying that you could never have an alcoholic beverage. Just know that if sleep is an issue, it might actually not be so helpful for you. A lot of people now, of course, have many different devices like your iPhone and your Android, etc. And so trying to avoid that blue light for at least a couple of hours before you go to sleep, that sort of unplugged nature kind of allows you to be able to relax and sometimes puts your mind at ease as well. The one last one that I will say is that this is something that can also be done with your healthcare provider is looking over the medicines you take and make sure that we're not taking medicines that interfere with sleep at night. So it may be as simple as saying, can I take this in the morning instead of at night? Let's make sure that nothing that I need to take for my overall health is actually going to interfere with my sleep.
For the folks out there listening who are thinking, you know what? I do think I'm ready to talk with my medical team about improving my sleep, my challenges with sleep. What does a typical evaluation and treatment plan look like for that person out there?
Yeah, this is really a conversation that you have with the healthcare team, and it's going to be a comprehensive review of what you're noticing. So what is the actual problem that you're having? Is it going to sleep? Is it staying asleep? Is it both? Trying to understand what that sleep pattern is. So for example, are you going to sleep at the same time every day? How much sleep do you actually want to get? What have you tried that may have helped or not helped? Then we also do things like comprehensive medication review. So what medications may be contributing? Are you taking anything over the counter, any supplements, any sleep aids that we need to know about? And then really doing a good history taking to make sure that we're not having any of those red flag symptoms that we've talked about. So are you snoring? Are you falling asleep during the daytime in an unexpected way? Are you having any issues where you're stopping breathing, et cetera? And so your doctor is going to ask you a lot of questions to try to make sure that there's not something else that's causing your sleep issue. And then once they have an assessment of that, they'll decide what the next step is. And typically, that really depends on what they have found from talking to you and doing an exam. It often includes testing for sleep disordered breathing. So looking for that sleep apnea, for example. They may ask you to keep a sleep diary, for example, where you write down what time you went to sleep, how many times were you awake, et cetera, to try to get a sense of the pattern. And it's very common that people will come back for more than one appointment for us to do this because we really want to do it well. And we want to partner with the patient and make sure that what we're recommending is right for them. One of the things that excites me the most is that while we say medicines are always an option, the great news is that we actually may not need medicines at all. Who doesn't want one fewer pill?
One less thing to have to keep track of? Oh my gosh.
Exactly. So I tell people, wouldn't it be wonderful if we didn't have to give you another medicine? And the exciting thing is often we don't.
That's great. Finally, what does aging forward mean to you? And how do you personally age well?
Aging forward is the ability to empower our patients and ourselves to be able to take control of our health and well-being, knowing what is important to us, knowing what things we want to try to preserve about our functionality, our ability, and knowing what are the unique gifts that we bring to the table that we can serve our friends and our family. I tell people the secret to aging well, the best part is it's not a secret at all, Kristen. There's two components. The first is staying physically active, because if you don't use it, you lose it, especially as you get older. And the second piece is staying engaged in things that bring your life meaning. So what brings you joy on a daily basis? How do you give back to your community? And what is the life that you want to live?
I just have had so much fun talking with you today. It's been such a pleasure.
Thank you all for having me today.
That's all for this episode. Hopefully you're feeling a little more informed, inspired, and empowered. If you have a topic suggestion for a future episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Aging Forward episodes and resources, head to mayoclinic.org/agingforward. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening, and until next time, stay curious and stay active.